This is a person with the normal lungs. Normal lungs are covered by a double-layered membrane around it. Between the membrane, normally there's no fluid or about just 5 to 10 cc of fluid in it. And the membrane helps the lung to open and protect the lung from trauma. If your lungs are healthy, you should be able to walk okay without any shortness of breath. You should also be able to carry heavy objects or run without any trouble. Pleural effusion is a condition where there is fluid or water around your lung, in between the membrane and your lungs, and the fluid prevents your lung to open fully. And that's why when you have fluid, your lung is not healthy, and you may feel sick. You may feel dyspnea or shortness of breath when you walk, and you cannot maintain your normal daily activities. You walk a lot slower, and you cannot keep up pace with other friends or people your age. You also feel tired and have no energy at all during the day, and you just want to sleep all day. If you go see a doctor and they suspect you having fluid or water around your lung, they would order a chest x-ray on the left-hand side like this, and then they can also order a CT scan or a CAT scan like in the right-hand side. There are multiple causes of pleural effusion, including heart failure, liver failure, kidney failure. Infection of the lung can cause pleural effusion. Cancer of any type can also cause pleural effusion. Other uncommon causes of pleural effusions are medication-induced pleural effusion, or sometimes the cause of pleural effusion is very difficult to identify. Most commonly, pleural effusion in the United States are caused by heart failure, cancer, and infection of the lungs. So how do you treat pleural effusion? First of all, if you have a lot of symptoms of shortness of breath, your doctor would advise you to have a procedure to drain the fluid or water around your lungs and to help your lung to open fully, to help your lung to breathe better. The procedure is called thoracentesis, which means they would give you a numbing medication through a needle, a very small needle, in between your rib cage to numb you up so you don't have any pain. And then after that, they will go in with a little longer needle to drain the fluid out from your lungs. The procedure is generally only about 20 to 30 minutes, depending on how much fluid that you have. And then it can be done either in the hospital or in the office. The procedure technically is very safe with about 98% of the safety record. Complications happen in about 2 to 5% of the time. And most common complication is pneumothorax or air leak around the lungs and bleeding. And those complications are usually self-contained, and it can also be managed. Serious complication is possible, but it's rare. The second part of the treatment is to find out why you have the pleural effusion, because if they don't know why you have the pleural fluid, then the pleural fluid can come back very frequently. The workup would include sending the pleural fluid for studies, and sometimes the doctor would also include sending your blood as well as an ultrasound or CT scan of your lungs. If all the non-invasive workup fail to find out why you have the pleural fluid, then if you keep having pleural effusion or water around your lung, your doctor may order a pleural biopsy. Basically, it is a procedure where they would biopsy the membrane around your lungs. The procedure usually is done with sedation, where you would be either halfly asleep or fully asleep, and then they would give you a lot of numbing medication, just like the other procedure, so you don't have any pain or you don't feel much. Then after that, they would make a very small incision, about 1.5 to 2 centimeter on your skin. Then they would use a camera to look inside the space in between the membrane of your lungs, and then they would see if there's any tumor in there or any area of suspicion, and then they would take a forceps to do a very tiny biopsy to send the cell for studies. This procedure is extremely important to rule out cancer, as this is about 20% of the causes of undiagnosed pleural effusion. During this procedure, sometimes the doctor can also offer other treatments as well. For example, indwelling pleural catheter to help with the recurrence of pleural effusion. And they can also offer what is called pleurodesis, which is to prevent recurrence of pleural effusion by attaching the pleural membranes together. This video is only for general knowledge. Please consult your doctor if you have any question about yourself. Thank you for watching.